This is a continuation of the ibuprofen. Of course, my patient has an inflammatory process. I'm going to give ibuprofen. I'm going to instruct the client to note that this medication can cause GI distress. Take the food. Taking food with the medication reduces the risk, avoiding alcohol consumption. And again, this is all with my education for my ibuprofen. I'm going to monitor platelet levels, liver levels, and kidney and liver levels as well. Now, with our prednisone, it's a glucocorticoid given to treat inflammation, used in low doses, monitor blood pressure, monitor their electrolytes, glucose levels, monitor for impaired healing in the clients. Taking this medication, they've got to take it with food, avoid stopping the medication abruptly. It's got to be tapered down, and report any unexpected weight gain. Now, that's with your prednisone. Okay, we got COVID-19 out here. Guess what they treating them with? Everybody getting Decadron. Decadron, prednisone. It's a steroid. Prednisone is a glucose corticosteroid, so you're going to have to monitor for sugar levels. Okay. Amphotericin B is an antifungal given to treat fungal infection. Of course, we're going to monitor our liver and kidney function levels. We're going to teach this patient that this medication can cause GI upset. Our interpersonal care, we're going to get cardiology on board, infectious disease is going to be on board, and physical therapy. I want cardiology on board because they're going to manage my cardiac dysfunction. I want infectious disease on board because guess what? When I have an antibiotic or a blood culture that comes back and the patient's resistant to everything that we have in the hospital, I need someone who has the expertise to say, hey, let's try this, okay? I need an infectious disease doctor on board to make sure that my bacteria is being treated appropriately. Lastly, I want that patient to have some physical therapy to increase that client's level of activity once prescribed. Now, our therapeutic procedures for pericarditis, our treatment for that, okay, pericarditis. Let's look at the word. Inflammation of fluid around the heart sac, okay? Periocardiosynthesis, okay? Anything with synthesis on the end of it, like thoracentesis, periocardiosynthesis, that's going to be to drain that fluid off of whatever body part you're talking about. So with the pericardiocentesis, that's the insertion of a needle into the pericardium to aspirate pericardial fluid. This can be done in the emergency department or in a procedure room. Now, all my years of working in the ER, I've never seen a ER doctor do this. This would be, of course, done typically under the care of the cardiologist, the cardiac thoracic surgeon, someone who's going to know what they're doing. Now, our nursing actions for what you're going to do. What you're going to do with that fluid after they've gotten it off the patient's lung. First thing you need to do, you need to secure it and make sure that it gets sent to the lab so that they can do a culture and sensitivity on it. Make sure that they can identify the bacteria or organism that's around this patient's heart. So I want to make sure that that fluid gets to the lab. And I'm not going to put it in the tube and shoot it up to the lab. Fluid that comes off a patient's heart, I'm going to walk it down there to the lab to make sure it's secure. I'm going to also monitor that patient for recurrence of cardiac tamponade. We haven't gotten there yet, but we're getting there, okay? Now, that's our therapeutic procedure for pericarditis. We're going to do a pericardiocentesis. We're going to take that fluid off and around the heart. We're going to send it down for culture and sensitivity. And we're going to monitor this patient for cardiac tamponade, which we're getting ready to get to. Now, with our infective endocarditis, remember our infective endocarditis, that patient's going to have those splinter hemorrhages, red streaks under their nails. They're going to have those flu-like symptoms, invasive procedures. They may have just had a tattoo or body piercing, or may just had some dental work. These patients, or they may have had a pacemaker or a prosthetic heart valve placed, or they may be an IV user. These are my patients where they're going to go in and do what's called a valve debridement, and they're going to drain the abscess and repair congenital shunts which are going to be the procedures involved with infective endocarditis. So again, infective endocarditis, you can have a valve debridement where they go in and scrape off, debride that valve of that infection or growth or whatever that's on there. There may be an abscess sitting there. I think of that with my IV drug user. If they've got an abscess there, they got to go in and do an IND of it. Or if they've got a shunt that was placed there when they were, like a baby or something, they may have to go in and repair that shunt. So those are our therapeutic procedures, okay, for these patients with infective endocarditis. Of course, you're going to monitor that patient for bleeding, infection, and alteration in cardiac output. Now, with my patient education, we're going to encourage that patient to take rest periods as needed. Wash our hands, hand washing to prevent infection, avoid crowded areas to reduce the risk of infection. Good oral hygiene and prevention of infection is important. Taking medications as prescribed. Demonstrate the administration of intravenous antibiotics and management before discharge. If that patient is going home on IV antibiotics, they may have to get home health involved. Participate in cessation of tobacco if they're still smoking. Understanding the illness, expressing their feelings, and advising all providers, including their dentists, that they have this history of endocarditis, so that they will get prophylactic antibiotics as prescribed. Now, after this patient has been discharged, again, like I said, home health can be indicated if the client had surgery. IV antibiotics can be given by the home health service. Pharmaceutical services can be indicated for IV supplies and medications. They've got to send the tubing. They may have to send an IV pump to the house. And then again, rehab services to get that patient back to their activity level. They may have to go to short-term rehab, or they may have physical therapy coming in the home one to two days a week. Now, I've been hinting on cardiac tamponade. I said that word 2 or 3 times throughout the 7-minute presentation. Cardiac tamponade is considered a medical emergency. Okay, you got to recognize it and get this patient to the OR. This can result from fluid accumulation in the pericardial sac. Typically, this patient is going to present with symptoms of shortness of breath, dizziness, tightening in the chest, increasing restlessness. They just can't be still. They just keep moving. Pulsus paradoxus. That's going to be a decrease of 10 millimeters of mercury or more in systolic blood pressure during inspiration. This patient's going to be tachycardic. They're going to have muffled heart sounds, and they, of course, are going to have jugular vein distension. Now, hemodynamic monitoring reveals intracardiac and pulmonary artery pressures similar and elevated, okay? And you don't want that. So what do you need to do if you suspect this? You owe it to this patient to be this patient's advocate. If you suspect it, you need to open your mouth and notify the provider immediately, okay? You're going to administer IV fluids to combat hypotension. You're going to get a stat chest x-ray or an echocardiogram to confirm the diagnosis. And of course, all these things are going to be ordered by the provider. But what do you need to be doing as the nurse? You need to be able to recognize these symptoms that the patient is experiencing to notify the provider so that they can get the right and appropriate test ordered to make the diagnosis. You're going to prepare the patient for pericardiocentesis, inform consent, gather materials, administer medications as prescribed. Again, you're going to monitor their blood pressure until they normalize. You're going to monitor their heart rhythm as changes indicate improper positioning of the needle. And you're going to monitor that patient for reoccurrence of manifestations after the procedure is over. Okay, you guys have got some good videos, I believe, in your module of these different types of disorders we're talking about. To get a visual look at them, I encourage you to take a look at those videos so you can see those as well. I'm going to stop that now. We're at 9 minutes and 50 seconds, and we're going to move on to questions in the next segment. Thank you.